Hello, I'm Keith Martin, the Executive Director of the Consortium of Universities for Global Health, and welcome to today's Consortium of Universities for Global Health webinar, A Tale of Two Collegiate Issues, Student Debt and Underrepresented Minorities in Higher Education in the United States. CUGH has a very active Trainee Advisory Committee. It puts out a number of products that address issues affecting students around the world. This particular webinar is going to deal with the two big issues I mentioned, student debt and underrepresented minorities. These are two massive challenges. In the United States, the size of the student debt is a staggering $1.67 trillion. That means tens of thousands of Americans are saddled with debt that goes on for many years. And the other big issue is the issue of underrepresented minorities in academia. A study showed the top 100 elite schools in the United States, there has been not only no change, but a decline in representation from Blacks and Hispanics in those schools. And I would venture to say the same goes for First Nations, and that is over the last 40 years. So here to address them, I'm going to turn it over to the chair of our Trainee Advisory Committee, Priscilla Auguste. Priscilla is a fourth-year medical student. She's an epidemiologist by trade. She's going to introduce our wonderful student speakers today. She will moderate the questions and answers. So get your questions ready and make sure you look at CUGH's website for our upcoming conference in March, CUGH2021.org, and make sure you send in your abstracts and put in some suggestions for our sessions. It's going to be a great conference, interactive, virtual, and you'll engage with people around the world. So with that, it's my pleasure to turn it over to Priscilla. Priscilla, over to you.
Thank you, Dr. Martin. Good morning, everyone, and thank you for coming to our talk today. We have essentially two advocacy groups that are represented today, the Underrepresented Minority Student Advocacy Group and the Student Debt Advocacy Group. Both of these groups consist of a collaboration between members of the CUGH Trainee Advisory Committee, as Dr. Martin mentioned, and students from multiple universities across the US. Presenting today from our Underrepresented Minorities Student Advocacy Group, we have Felucia Ishola, a third-year medical student from McGill University, Faculty of Medicine, and Emma Herbach, a third-year PhD candidate at the University of Iowa, Department of Epidemiology. Presenting today from our Student Debt Advocacy Group, we have Sabrina Kubisa, a dually enrolled undergraduate, senior, and first-year Masters of Public Health student from St. Catherine's University, and Shangir Sadiq, a fourth-year medical student from University of Texas Medical Branch in Galveston. We're really excited to share this presentation with you. So at this, I'm going to hand it over to Felucia Ishola from the Underrepresented Minorities Group so she can start off the discussion on the underrepresentation of minorities in secondary and post-secondary institutions.
Thank you very much, Priscilla. And just to mention, I'm a third-year PhD student at McGill. And thank you for the introduction again. Today, Emma and I will be discussing how we can increase representation of racial and ethnic minorities in secondary and post-secondary education in the United States. And we'll be using a few terminologies, which include global health, and which is an emerging field of research and practice that prioritizes the achievement of health equity for people worldwide. And also we'll be talking about the global health workforce. And by this, we mean the sum of professions promoting health equity in medicine, nursing, science, and public health. And when we refer to underrepresented minorities, we also mean the racial and ethnic populations such as the Blacks, Mexican Americans, Native Americans, mainland Puerto Ricans who are underrepresented in the medical and scientific health professions relative to the numbers in the general population. And we'll also be referring to health equity, which is the idea that everyone should have a fair opportunity to attain their full health potential and that no one should be disadvantaged from achieving this potential. So looking at this slide, in the United States, looking at the breakdown of bachelor's degrees awarded by race and ethnicity, we can see that majority of the graduates from science, engineering, and other programs are predominantly white. Now, also looking at this table, if you look closely at the second column, referring to all underrepresented minority groups, less than 20%, 19.8 to be exact, of public health doctoral recipients are comprised of underrepresented minorities of any race or ethnicity. And this cuts across all most disciplines, including biostatistics, epidemiology, and public health in general. Also, this is comparing the Latino populations to the African American populations, and we see that compared to the in California in 2015, and we see that compared to the total population, African Americans represented in graduates of medicine and other professions are relatively lower than that of the Latinos. So having described the lack of diversity in the field, it's worth exploring why this is something that warrants urgent attention. And we will do this in two ways, in terms of social justice and equality, and in terms of global health. And by focusing our attention on increasing diversity, we can provide opportunities for social mobility. What do I mean by this? That means allowing people to change their social status, either moving to higher social status through better education and higher income. And also, if we give racial and ethnic minorities a seat at the table to bring their unique perspectives and ideas, we can enhance our ability to make better, culturally competent and informed decisions, which of course will improve the direction of global health research and implementation of intervention. Also, increasing diversity in the workforce increases access to healthcare in disadvantaged communities. How? This increases the number of providers who serve minorities in disadvantaged communities. For example, providers who come from these backgrounds are more likely to return to serve their community and stay there, compared to, for example, maybe grants that incentivize providers to serve rural communities, in which providers are likely to leave that area once their minimum time requirement is met. And also, we talk in terms of racially concordant health providers, where care provided by member of a patient's racial or ethnic identity has been well established to improve health outcomes vis-a-vis better provider-patient communication and also patient satisfaction. And finally, a focus on diversity in higher education will provide the opportunity for more research on health disparities. And so we feel in order to understand how we can tackle the problem of underrepresentation, we need to first understand what exactly are the barriers we face. And we do this describing the educational pipeline, because barriers to achieving racial and ethnic diversity in the global health workforce are established early in the educational pipeline, beginning with inequities in school funding, access to quality education, and adequate preparation for higher education. In the United States today, students of color and students from low-income families receive less state and local funding in their school districts compared to districts in more affluent neighborhoods that serve fewer students of color. And even as students continue down the educational pipeline, they face even more barriers. For example, now, college admission standards implicitly grant biased preference to students from privileged backgrounds who have resources to participate in extracurricular activities, standardized test preparations, and usually prestigious learning opportunities like unpaid internship, which students from low income may not have access to. And this economic disadvantage and early educational inequities pose critical obstacles to minority students, decreasing their overall likelihood of entering or completing higher education. Now, at the college level, most times there's limited exposure to global health training opportunities, such as international experiences, and This can leave underrepresented minority students in the dark about postgraduate education and practical learning opportunities that may fit their interests and lead them into global health workforce. And with all the obstacles I've mentioned, let's say an underrepresented minority student overcome this and attempt to break into the field as a graduate student or trainee. The lack of diverse faculty in global health poses another barrier to recruitment and retention. And finally, escalating fiscal pressures coupled with increasing costs of tuition further makes it difficult for institutions to meet the financial needs of students from low socioeconomic levels. And so now I'll be handing it over to Emma to talk about the solutions to the barriers I've mentioned.
Thank you, Felicia. So building off the barriers that Felicia has just described, I will now propose some solutions to some of the obstacles encountered at the various phases of the educational pipeline. The 4 overarching areas that should be prioritized are the quality of and retention in K-12 education, preparation for and retention in post-secondary education, and recruitment to and completion of graduate education. Within each phase, I will propose solutions directed towards various roles stakeholders may take action in to work towards our collective goal. First, we must dismantle barriers that occur in primary and secondary education. Federal and state education departments must reframe their priorities to promote equity in the quality of education we provide. They may do this by strategically revising and expanding federally controlled funding to state education departments to improve public education systems and allocating funds to underserved schools and districts. Education departments should also prioritize and incentivize efforts to reduce variation in quality of education between schools, districts, and states. Primary and secondary education institutions should decrease the racial and ethnic imbalance between teacher and student bodies and design education programs to support teachers in meeting the diverse needs of their students. And lastly, they must set URM students up for success by scaling up individualized tutorial programs for disadvantaged students who fall behind to increase their chances of graduating high school. Next, we must address obstacles that leave URM students underprepared for post-secondary education and/or unaware of future career opportunities. Secondary education institutions and educators may improve their students' preparation for higher ed by establishing the infrastructure to do the following: support and encourage URM students to enroll and excel in advanced placement courses, provide resume-boosting extracurricular activities that don't require a financial ability, and utilizing culturally appropriate messaging to encourage academic persistence and achievement that resonates with underserved student groups. We must also expose our students to our field earlier in their academic careers. Secondary education institutions should revise their curriculum to introduce global health topics and hire appropriately qualified teachers, and host interesting events for students, such as global and public health career days or field trips. Global health professional organizations must also take responsibility to reach URM students by instituting programs to interact with and educate students in our communities and create more training opportunities for younger students that don't require them to overcome financial or other barriers to participation. Once URM students reach post-secondary education, they face barriers that reduce their ability to complete their degrees. Faculty in higher education, especially racial and ethnic minority professors, are in a unique position to support URM students through mentorship, providing emotional support about shared hardships in the academic world, and serving as an example of what they have the potential to achieve. Faculty may also play a key role in cultivating a sense of academic belonging. Faculty may be critical actors in an individual student's experience, but higher education institutions must first enact change to support and reinforce the faculty's role in URM retention. First, diversity must be prioritized at the institutional level by clearly establishing diversity as an institutional priority and collaborating with other institutions to share and implement best practices and successes. They must support URM faculty and staff by prioritizing diversity in hiring practices, creating space for URMs to participate and be heard in decision-making spaces, and incentivizing research into diversity-related topics through funding and opportunities for recognition. Lastly, higher ed institutions have the responsibility to directly support their URM students by addressing financial barriers to retention through dedicating scholarship funding to reduce financial burdens that preclude acceptance into and completion of academic degrees, and creating workshops designed to help students attain financial literacy. Additionally, URM students attaining educational excellence should be recognized and rewarded at the institutional level. Lastly, we must address the barriers to obtaining graduate education. As members of the global health workforce, we have the ability to volunteer our time to mentor and set examples for URM students, and to use our position to appeal to Senate and House representatives on behalf of URM students to enhance their educational opportunities. However, educational institutions are still responsible for enacting institution-level change to support URM graduate student success. Admissions processes must be revised to prioritize diversity using qualitative metrics such as an applicant's ability to overcome adversity and service to their community, and incentivize research that demonstrates the effects of diversity and aims to reduce racial and ethnic inequalities, including recognizing faculty members working to promote equity. In conclusion, the underrepresentation of racial and ethnic minorities in higher education is an issue that warrants urgent attention and action at the system, institution, and community levels. We have the power to set URM students up for success and reframe their academic experiences to minimize the number of obstacles they must overcome to succeed. I'd like to end on a positive note by briefly discussing some of the successes that have been achieved by interventions developed to dismantle barriers by implementing some of the solutions we've described today. Some of those achievements include increasing enrollment in graduate programs, improved degree completion rates for undergraduate and graduate students, higher GPAs, students reporting feeling supported and like they belong in their academic environment, and successful entrance into science research and healthcare professions. I would like to acknowledge the Underrepresented Minority Advocacy Group as a whole, with a special thank you to Melissa Salm for developing the first draft of these slides. Thank you to Dr. Keith Martin for your support and advocacy for our team, and to the CUGH Workforce Subcommittee for your guidance and feedback. Thank you all for your time, and I will now pass it over to Sabrina and Shangir with the Student Debt Advocacy Group.
Thank you, Emma, and thank you everyone for being here. So our group looked at the implications of student debt as well as some multidimensional solutions to address it. So some factors that contribute to the existence of student debt include increased tuition costs, which result from the pressure on universities to expand, the federal and state student loans and less scholarships, some socioeconomic and racial disparities, and these cause students from lower income families and ethnic minority families to have higher loan burdens. Other factors may also include being a single mother, being an international student, or being in graduate school, and so on. So what are the burdens of student debt? In the United States, student debt tripled from over $1.6 trillion between 2006 and 2019. And between 2017 and 2018, the average student loan per degree reached $16,800. So how does student loan look like in healthcare field? And the reason why we are using healthcare field is to use it as a model to show us how student debt can affect a particular field. Although student debts consist of 5% of all graduate levels, it accounts for 30% of the burden debt. In 2019, the average student loan for healthcare field reached more than $160,000. And in 2015, 45% of medical students owed $200,000. Student debt can also affect students on so many levels and in so many ways. It can reduce students' interest in healthcare fields, especially in primary healthcare fields, and that pushes students to pursue more specialized field where they expect more income in the future. It can also negatively affect people's health by increasing the risk of heart disease or depression and others. It can also lead to poor academic performance and can also negatively affect students' finances. Now I'll pass it over to Shanghir to walk us through some solutions.
Thank you, Sabrina. So as Sabrina indicated, the problem of student debt is well established, with a lot of research to prove that it is not getting better in recent years. The first kind of solution that people usually jump to when we're talking about how we solve this issue is loan repayment / forgiveness options. And there are multiple opportunities for this. For example, the HRSA loan repayment programs, the Public Service Loan Forgiveness Program, working in the specific industries such as the Nurses Corps. However, one thing we have to keep in mind is that if these programs were all 100% successful, we probably shouldn't expect the debt burden to be increasing year after year after year. Additionally, as you can tell from the programs in front of you, most of these programs are tied to either working with a specific population or working in a specific geographic area, making it unable to be fulfilled by certain other students who may not be able to work in those specific circumstances. So on the next slide, we're going to go ahead and talk about what we need to do as a global health workforce to address these issues. And the answer to that is quite simple. We need to expand our solutions. And one thing we wanted to really draw attention to in our white paper project and within this webinar is the need for a systems-based approach to handle these issues. While we can talk about individual solutions at the federal or state level, we have to keep in mind that all of these solutions are working in tandem with each other. And as such, we need to optimize how they work together for the benefit of the students. On the next slide, I'll go ahead and start off discussing the federal level. So when we think about the federal level, the number one thing we'll always talk about is, again, those public service loan forgiveness programs. But one thing that we alluded to already is that not every single applicant who submits an application gets their loans forgiven within that same year. There are multiple steps that they have to fill out, multiple requirements. They have to make at least 120 payments before they're even eligible to submit the application. And oftentimes they may not meet those requirements, meaning they do not get their debt burden relieved. So we recommend that the federal level expand these programs, and more importantly, increase the approval rate for the applications submitted. This could include streamlining the process, having a quicker turnaround, or simply dedicating more funds to it in our federal budget. The Pell Grant is a well-celebrated way that students, especially from the lower socioeconomic strata, can have access to higher education. But there are discussions within the higher education arena about increasing the eligibility level. So potentially more students, especially in the lower middle class area, have access to the Pell Grant and can utilize it for their education. Establishing federal and state partnerships is absolutely key. Unfortunately, what we realized when we were doing our research is that there are many programs operating at the federal level, and then also many programs operating at the state level that often do not interact at all. This can make it difficult for students who may be eligible for both federal and state benefits to properly utilize them. So we recommend streamlining the resources and requirements so students who are eligible to use these resources have knowledge of them and have access to them. A great example of this is the FAFSA application, which again is technically for federal support, but universities across the United States have used it as a mechanism to distribute need-based grants and scholarships and loans. So it is already being done. We advocate for more activity and collaboration like that. Consolidating income-based repayment so we could actually have people paying off their loans in an effective manner once they graduate is key. Every year you don't make a payment, every month that you don't make a payment, your interest is accruing. So definitely tackling that from the beginning when we still have a good shot of lowering that debt burden is especially important for our students. And lastly, something that's been well discussed by the media and higher education circles is reducing the reliance on risky private loans. With the federal government stepping in and providing a good amount of the loans that we currently have access to as students, this is not as big of an issue as it once was. However, there are many students who still rely on private loans as an extra source of income while they're in education. And this can mean them having to budget a completely separate set of money towards paying off their private loans in addition to their federal loans. Additionally, you can't consolidate those two types of loans together. So it adds a lot of stress to students and a lot of requirements on them to keep track of every single aspect of their monthly budget once they graduate in an effort to pay off all of those loans. On the next slide, I'll go ahead and talk about the state level. Same thing that we discussed before, certain states have taken steps of providing loan forgiveness programs, often tied to public service. Again, we advocate that we continue to expand those programs and expand accessibility to those programs. Importantly, however, we know that states usually provide some level of funding to universities in the form of support, especially those public colleges and public universities that are tied to the state legislature. However, we would advocate beyond that. We would like the states to provide direct support to their students in the form of either direct grants or allocating funding that goes to these universities to be specifically for student debt, or providing grants to relieve student debt. We need to increase our public funding. Over the past couple of decades, we've seen pretty much across the board that states have narrowed their budget for their universities, often causing those universities to increase their tuition payments in an effort to maintain their institutions, if not to expand them, as we've seen in recent years. So we advocate for state legislatures and governments to, again, go back to how it used to be, provide the funding that we need at the state level for these public institutions so that they can, again, focus more on more of their resources on the students. Increase need-based grants, both to institutions and to students. And lastly, establishing some method of institutional accountability. Funding should always be data-driven. So how are students doing once they graduate? How many of those students are graduating within 4 years? How many of those students are entering the workforce with a full-time position 6 months after graduation? How many students are paying off the debt that they've accrued or have the ability to pay off the debt accrued? Unfortunately, across the United States, we see specific issues, sometimes tied to the institution, sometimes tied to the field. Right now, we see it with COVID, of course, where students may graduate with a higher education degree, but not be able to enter the workforce to pay it off. And this entire time, while they may attempt to defer payments, some students are not lucky and interest accrual begins. So definitely holding our institutions accountable, asking them what they're doing to support their students to enter the workforce successfully, to pay off their loans successfully. And then if they're doing an excellent job, obviously supporting and supplementing that so they can continue to do an excellent job. At the next slide, I'll go ahead and discuss the institutional level. We've seen this trend where universities have launched wide development campaigns, endowment campaigns to increase the amount of funding available to them to utilize. And we have a few institutions that have definitely allocated some of that funding that they raise specifically to tackle financial aid packages. NYU University did an excellent example, is an excellent example of this in terms of their School of Medicine, where students there no longer have to pay tuition as established by a very strong endowment through philanthropic efforts of a very well-respected individual. So we call on institutions across the board to do the exact same thing. When the presidents are meeting with their vice presidents of development, of fundraising, of finance, they should have that conversation of, we want to have a specific fundraiser, specific development campaign for funds for students. And again, we understand that institutions need to continue to expand. They need to continue to attract high-level and well-established faculty. But we also believe that the primary role of universities is to support these students within their training, and so that they're able to enter the workforce and contribute to society. And unfortunately, at this point in time with the debt burden, this is no longer something we should only discuss. This is something we need to act on immediately. Universities should also look at their degree programs and find ways to streamline them. So students who may have the opportunity to graduate early, for example, in 3 years versus 4, or 3.5 years versus 4, can do that and prevent them from paying for additional coursework that they may not require. We've seen some institutions do this with early acceptance programs, with early college credit programs, and also with dual degree programs where students can truncate the amount of time they spend establishing for all their career educational requirements for their careers. So it's already being done, but we advocate for this on a more national level. Importantly, we've always heard, especially thinking back to, once upon a time in the 70s and 80s, that students would work in the summer and be able to pay their tuition just with the money that they've gotten in that one summer job. Obviously, the current reality is not that, but we do think there is value with having access to employment, especially part-time employment for students during their 4 years. It allows them to build a resume. It allows them to get experience working, even if it isn't only in a part-time manner. So we call on institutions to foster a campus environment that empowers students to seek those jobs, to give them the opportunities to work, perhaps on campus, and to utilize programs like the federal work-study programs that provide federal support to allow students to have the supplemental income during their time in college. Lastly, financial literacy is crucial. While people may not normally think that you go to college to learn about how to pay your taxes, we would argue that that is something that we should know. We should know about what kind of loans we're getting into. We should know about how to pay off loans. And we should know that once we finish our time at university, we're expected to not only pay taxes on multiple sources of income, but we're also expected to pay off those loans and how we can do that effectively. So establishing good programs for financial literacy, either in the way of coursework or in the way of providing extra didactics, webinars, workshops, so students can have a good idea of what they can do to handle their debt burden. Lastly, and definitely not least, on the next slide, I'll be talking about the individual level. The first thing we as a society need to do is dispel misconceptions about source of debt for current students. When we talk about especially the millennial generation, we often have discussions of, well, they spend money on coffee, they spend money on avocado toast. If they cut out their daily Starbucks coffee, they could save $1,500 a year. By the way, these are figures that I'm vaguely alluding to, they're not exact amounts. But as we've discussed previously, with the amount of loans students accrue with their undergraduate degree, they could buy more than just a cup of coffee. They could buy a car. With the amount of loans that students accrue at the graduate level, people can afford a house, sometimes two. So this isn't an issue of tightening the belt, saving money where we can, and then somehow solving the student debt crisis. This is a systemic issue that needs the collaboration of everyone, most importantly, the students themselves. For students, we recommend prioritizing total cost of attendance when you're selecting your programs. This is something that is discussed in high school, junior, senior year, where they look at different programs they want to apply to, then they do the research, often with a guidance counselor or their parents, to establish what will their potential debt burden look like in the future. And again, this is where we talk about, do we want to go to a public school or a private school? Do we want to go to an in-state or out-of-state institution? Do we want to go to a program that's offering a larger financial aid package versus a program that may not be offering a financial aid package? Again, we're seeing institutions step up to the plate, maybe not as much as they need to, but definitely moving towards that direction of providing support to students. And we call on students to utilize that information. Importantly, we always recommend students reaching out to the financial aid offices at these institutions. Ask them the questions that we talked about. How many of your students have loans by the time they're graduating? What kind of jobs are they getting into when they graduate? What is the average loan amount for a fourth year versus a sixth year student? Financial aid offices should have some information that could be used to guide students before they make their final decision and sign that paper to enroll in that university. In addition to analyzing total cost of attendance at their specific institutions, again, we agree, we do need to tighten the belt, unfortunately, and we can minimize personal expenses by budgeting effectively, again, tying it back to financial literacy, carpooling, cooking at home, having roommates instead of living by yourself. These are ways that students can take control over their daily expenses, their monthly expenses while they're in college. And lastly, what we definitely advocate for is parental collaboration. with their students. College is seen as the introduction to adulthood. This is their first opportunity to go out into the world to be truly independent. Unfortunately, it comes with a very high sticker tag and price tag to try to handle that freedom and establish themselves for a future career. So we recommend individuals talk about child savings accounts, having that established system of saving for the future with their children. We recommend them discussing financial responsibility with children before starting college, and most importantly, providing some sort of support. Unfortunately, and this is something we came across in multiple areas, either lower socioeconomic strata or specific underrepresented minorities, some parents just are not able to contribute financially to their children's education. But what they can do is work with their children to find the institutions that can offer that needed support, because they are out there. A good example are the Ivy League institutions that have decided to not only be need blind in their admissions process, but also to meet the need of the students that are admitted. So it is a collaborative effort between parents and students, as well as every other stakeholder within this system. I'll conclude on the next slide. What are our key takeaways? The student debt crisis is getting worse. The current solutions are not solving it, and we need to act quickly before it spirals out of control. We need to expand and create viable solutions in a system-wide effort, collaborating with each stakeholder at each level to make sure our students are utilizing the benefits that currently exist and also building on those benefits. Specific efforts should be made to focus on scholarships and grants that don't rely on repayment, but in the case where we cannot do that, establishing repayment programs that are accessible to students so that they can actually utilize them and get those applications approved. Lastly, student empowerment and financial literacy is crucial. We must remember that at the end of the day, student debt is about students, and now, given the passing of time, recent graduates. We need to empower them to take control over the situation before it's too late and they're no longer able to take control later on with a huge debt burden. On the next slide, I'd like to go ahead and thank everyone for attending. And on the following one, moving on to the acknowledgements, the entire student debt advocacy team did an excellent job researching and providing for this webinar and our white paper. Priscilla led our projects with grace and empowered us to make the statements that we felt were necessary on this topic. Lastly, we want to thank Dr. Martin and CUGH for giving students the opportunity to talk about student debt, to share our perspective and share what we feel we need to be successful in our future careers and to contribute back to society. At this point, I'd like to go ahead and turn it back to Priscilla, who will continue the presentation.
Thank you so much, Felucio, Emma, Sabrina, and Shangir for some really great presentations. We do have some great questions lined up for you from the audience. So at that, I'm just going to get into it. So the first question I have, I'm going to address to Felucio. So how do you perceive that academic institutions will work to address underrepresentation of minorities in the admissions process?
Thank you very much, Priscilla. I mean, that's a very good question, and it's an important one. And basically, because there's this myth that diversity and excellence are mutually exclusive, and that by focusing on finding diverse candidates, the academic quality of a department or university will decline. And this is especially critical because research has shown that the opposite is true. Diversity in race and gender has a positive relationship to rankings at research universities. And many students and faculties want to be in diverse environments where people have a range of backgrounds and perspectives. And so in the past, people have talked about having a cutoff, a merit cutoff above which all the candidates you're looking at have the academic qualifications and rich backgrounds to meet your boxes that you want ticked. And if you have this range of candidates, you can then start looking into the diversity among these good candidates you have. So I feel like in the past, some universities and have looked into this method of increasing the diversity in the applicants.
Thank you, Felicio. Emma, did you want to add anything to that before we move on?
That was great, thank you.
Okay, so then we'll move on to the next question. This one I'm going to pose to Shangir. So by and large, one of the audience members says international students are eligible for student loans, which they consider to be a major barrier. Are there any suggestions for other ways for students to access loans?
That's an excellent question. It's something that we definitely need to talk about with universities expanding to attract more students from an international audience. The best answer I could give to that is if institutions are going to make an effort to increase international student populations at their universities, they should also have a system in place to support them once they're here. We see that in the form of international student offices, specific events for international students to help them acclimate to living in a brand new country. However, having that financial backing is absolutely crucial. One solution that we talked about in our white paper is instead of relying on federal or state loans, institutions can create a university loan repayment program. So students can get loans from the university and pay back the university. Theoretically, in this setting, their citizenship status or their country of origin should not be considered a barrier, given that if they're able to meet the requirements for admission to the institution, they should have access to the benefits associated to all students within that admission. There are private organizations that provide scholarships and grants, so providing that information to international students so that they can utilize those efforts. And lastly, again, utilizing on-campus employment or helping them find a job within the community, hopefully so that they could have some sort of supplemental income during their time at the institution.
Thank you, Shangir. With that, I'm going to move on to the next question. One of the audience members, I'm actually going to pivot this question to Keith, has asked about how educational loans are actually handled in Canada today.
Well, thank you, Priscilla. It is different from the United States. I think the first point to make, though, is that the cost of an education in a post-secondary institution is far, far less in Canada. That's the first point. The second, the way the loans are restructured is two ways. The federal government has a Canada Student Loan Program, and then each of the provinces have their own student loan program. So it's integrated between both of them. The other point is that a lot of the provinces don't charge interest on the loan. So not only the loan's less, you're not receiving and having it to pay interest on them. So the debt burden on the student is far, far less. Over to you, Priscilla.
Thank you, Dr. Martin. So the next question is actually also about student debt. So I'm going to pivot this question to Sabrina. One of the audience members has asked, what connections are being made with employers of the graduates? What advocacy efforts are underway to get salaries to be higher?
Thank you for the question. I think we mentioned in our paper a little bit about some loan forgiveness that come from employment. For instance, if you work as a nurse corps, then you will be forgiven some loans. So other specific ones, I'm not sure now. However, programs such as the nurse corps that we talked about in our paper, they offer loan forgiveness as well as some other public services that you can do. And usually it comes with public service, or you give your time or your expertise and your loan will be forgiven. So I think more research should be done on which companies or which organization offer that. But also more organizations also should look for ways to create some kind of loan forgiveness in their own companies. Thank you.
Thank you, Sabrina. I just wanted to ask to see whether or not, Shangir, if you had any follow-up or any other input you wanted to add to this question.
I think in terms of salary, supplementing salary with other forms of income, it's something that unfortunately is beyond just the scope of what undergraduate students can do, for example, but when they graduate. Obviously, the discussion when you're establishing a work contract with a specific organization can include that discussion. So oftentimes as a medical student, what I hear is that when doctors work at a specific hospital, they may be offered a certain starting bonus to help pay off their loans. So it's a conversation that recent graduates, when they're entering the workforce, should have in terms of, am I going to get a higher salary to pay off my loans? Are you going to provide additional resources to pay off my loans? But, and this is a big but, we do agree that they are at a disadvantage. Right now with COVID-19, the job market is scarce. So for recent graduates entering the workforce and negotiating for this additional supplemental income, one can only wonder if it may hinder them in their ability to get a position. So again, it's a society-wide problem. Unfortunately, it's beyond just the higher education arena. We would need the public and private sectors to be a part of this conversation and to agree to provide this support for students and recent graduates.
Thank you, Shangir. So the next question, I'm going to pivot to Felicia. Felicia, from your personal experience, one of the audience members has asked, how does diversity and university and healthcare services benefit the patients?
Thank you very much, Priscilla. I think one of the points we mentioned in a presentation is that by having diversity, especially in the healthcare workforce, it increased the care and the services provided for the underrepresented minorities or disadvantaged people, especially in terms of healthcare, because we all know that healthcare professionals from these backgrounds are more likely to work in these communities. They understand these communities. Provider-patient interaction is always better than people. Than, for example, there's been some ways in which governments would try to incentivize providers to go into these rural areas in these indigenous backgrounds for people to work there. And what happens is that at the end of their contract, these people end up leaving because they've not really integrated with this community. And so by having diversity, especially in the workforce, we have more people to service this type of communities and represent them.
Thank you, Felicia. It was a really great explanation. The next question I have, I'm going to pivot to the student debt group. So Sabrina and Shangir, I'd like you to try and see if you can answer this, and I'll start with Sabrina. So there's been a lot of discussion, especially in light of the COVID era that we're currently living in, regarding student debt forgiveness and whether it should be across the board or within subgroups such as healthcare workers. What are your thoughts about this being a potential solution for the student issue? And what do you think would happen if student debt was forgiven, across the board? Sabrina?
Yeah, thank you for the question. I think the pandemic has led many people to look at issues through a new eye. And right now that we're talking about probably suspending student loan during the time of the pandemic, or suspending the interest rate, or just forgiving a certain amount of the student loan. And I think this has to be a solution that is taken with steps and using strategies, because student loans also affect the economy. They affect the economy of the students who are borrowing the money, in terms of if they'll be able to own a house, or if they'll be able to start saving for their retirement, or just building their wealth. So for me, what I think is we should start talking about levels on which we can forgive student loans. For instance, forgiving a certain amount first during this time where new students are probably not getting the jobs they expected when they finish due to the pandemic. And suspending a certain amount of student loan can be helpful. But also looking at, as we talked about the example of Canada, where there is no interest on the student debt, the student loans, So that can also be a way to look at this. But in all ways, I think it needs to have interprofessional look at it, where people from an economic point of view come and add onto this, as well as students, as well as institutions, to see what can work best, both to help students and to make sure that the economy is maintained. I'll pass it over to Highe if he has more to add.
I absolutely agree with so many of your great points, Sabrina, and I just want to add on a little bit. When we talk about student loan forgiveness, one thing I've noticed in discourse is that we almost think of it as a one-stop solution, that, okay, if we forgive all the loans that are currently out there, we're fine. We've handled the crisis. But one thing I'd like to pose to the proponents of this argument, as well as to the institutions themselves that have students going in every single year, is that yes, we may resolve the loans for that specific population at this specific time, but how much time would it take for the new batch of students who are going to be taking loans again to have the same debt burden? As we've established in our white paper and in this presentation, this isn't a single problem where if we tackle it from this one perspective, it solves the issue. And again, I feel like that solution of, okay, we're going to forgive all the current loans is definitely beneficial for the individual arena. But as many people will argue on the other side, where will that money come from? One issue with forgiving loans, even with our current loan forgiveness programs, is that if you have a certain amount of loans written off, essentially you're no longer obligated to pay for it, it's often added on to your taxable income the year that you have those loans forgiven. So are individuals even able to pay the taxes they would owe on those forgiven loans? And again, if we're talking about a subset of a population that's a recent college graduate, has not gotten a job yet because the workforce is, again, what it is currently, we have to think about, are they going to be able to pay taxes on those forgiven loans? So it's definitely more of an issue of how are we going to handle this systemically? What are we going to talk about long-term developments? Are they going to pay interest rates just like Sabrina addressed? Are they going to pay taxes on forgiven loans? If we forgive it once, are we going to forgive it again? How are we going to handle it? And as I've alluded to multiple times, this involves collaborators from across the spectrum. It's not something that just students and just colleges can talk about.
Thank you, Sabrina and Highe. I think your responses are very well phrased, and I think that they're very important to consider. So for the last question, I will be posing it to Felicio. And this question, I think Emma kind of touched on it a little bit. It was related to one of the questions that was asked by the audience members. But one of the issues that frequently comes up when trying to address the underrepresentation of minorities at the admissions level is whether this leads to a fairness in admission selection. So I just wanted you to just provide your thoughts on this.
Yeah, thank you very much, Priscilla. I mean, most people against diversity have always kind of like, talked about is it fair, and are we looking at merit when we talk about diversity? And the truth is that, like I mentioned earlier in my explanation, and when we talk about this, we talk about as if there are two different things. As if when we talk about diversity, we are talking about people that are not qualified for this position. And there are people that are diverse and well qualified for this position. And so it's important admissions can be fair also, and also be there can also be diversity. I mentioned earlier that even in CUGH, sometimes, especially in TAC, when we do an admission process, in an effort to create diversity and also to make sure that we are fair, sometimes we have like a cutoff, a merit cutoff above which we know that all these candidates above a particular cutoff are sound, and then we start looking at the diverse population in this among these people. And so it's not I feel like moving away from diversity would be unfair, given the obstacles that we've mentioned earlier about people finding it difficult, especially in early life, trying to having the same opportunities that some other people do not have, especially in terms of maybe private tutoring, internship, and a host of other opportunities. So what do we then say that, children who are from low income households that do not have all this opportunity, is that also fair? So I feel like, that's another way to look at this process, and, people might beg to differ, but that's what I feel.
And before we close off, Emma, did you have any additional thoughts on the issue?
Sure, I can say something. I think something that I think about is just like when and we hear this a lot when we talk about ways to change our admissions processes to increase diversity, and it comes up, well, if we reserve more spots for more diverse applicants, is that fair to the other people who may not receive that advantage? And I just think it's important to consider how we think about the word fair and fair to whom. And it's important to consider like things like income, for example. And if we make more space for underrepresented racial and ethnic minorities in the places they do apply, we know minorities are more likely to have low income, and so they may not be able to apply to as many places. So that if we create more space for them in one institution, the majority may have more of an ability to be accepted elsewhere. And so although it feels kind of like a patchwork, unfair thing, that it's not the other students' fault at the time of acceptance, it's not the other students' fault and it's unfair to them. But thinking about that's kind of one end of the spectrum, and there are other opportunities that may be available to some and not to others. So I just think it's important to reflect on the question of fair to whom and what do we mean by fair.
Thank you again, Felucio, Emma, Sabrina, and Shangir for taking your time to answer these questions. And so with that, I'm going to hand it over back to you, Dr. Martin, to close us off.
Thank you very much, Priscilla. And I'd just like to thank all of you for attending the webinar today. And I'd particularly like to thank, obviously, Priscilla for doing such a wonderful job and leading the effort today, and as the chair of the Trainee Advisory Committee. She's doing a fantastic job. I'd like to thank Felucio and Emma for the incredible work you and your teams have done on the student debt issue. As all of you have heard, this is a critically important issue for students and everybody in the United States. I'd also like to thank Sabrina and Shangir for their outstanding work on how do we increase diversity in academia. So with that, just please know that this webinar is going to be on CUGH's website, CUGH.org. Please also, again, as Priscilla mentioned before, please send in your posters and ideas for sessions during our conference next March. It's going to be a very interactive and virtual conference where you can interact with colleagues around the world at CUGH2021.org. I'd like to thank Jenna Smith, who produces the webinars, that does a great job on our team in doing that. And finally, next month, it's election time. So please get out and vote. The issues you heard about today are issues of social justice. They're issues that deal with deep, pervasive inequalities in the United States. We've also heard from all of the speakers today that they can be addressed. The speakers provided us with solutions on how to do it. That will only happen if we get engaged politically, make sure elected officials will do the kind of solutions and support the solutions you heard from today. And your power is to vote. So please do. Thanks for joining us today. Have a wonderful day. Stay safe. Bye for now.